Who's Dr. Minter? Oh, here. We are good to go? Okay. Good morning, everyone, and thank you for being here this morning. As your county judge, and I always promised, we are going to provide always the information, what is happening in Fort Bend County, transparency, communication. This kind of stuff is very important to us. And that is the very reason why last year and a half, maybe more than that, and we always invited you and got in front of you and explained what is happening in Fort Bend County. Today is one of those days. We wanted to tell you there are some changes to our numbers, and there are there is some increase in COVID positive numbers and things of that nature. And we just wanted to let you know that in advance, so that you're not concerned, or you need to be careful. You need to be living your life with caution. But at the same time, I just wanted to say, live your life. It is concerning to us, but that means the message is live cautiously. And these informations, we are sharing it with you to help you understand, COVID is still here. It is real. And these days, what is happening is community spread. This is not coming from somewhere else. Last maybe 6 weeks, 7 weeks, we have seen an exponential increase in numbers. And obviously, we are blessed to have our Health and Human Services Director and also our local health authority, Dr. Minter. I will invite Dr. Minter to give specific details of the latest increase and latest numbers in Fort Bend County. With that, Dr. Minter, please come forward.
Thank you, Judge. Good morning, everyone. I appreciate the opportunity to advise you of significant changes to our publicly reported data that will occur over the next week or so. As some of you may recall, in April, the state of Texas announced a data management and contact tracing system called Texas Health Trace. This system was initiated to allow local health departments to work on behalf of their communities to access state-collected lab reports. The goal of this was to improve investigation of cases and improve contact tracing throughout the state. The system rollout occurred in late May, and that's when it began, and since that time, the state has been working with us to ensure that we have had adequate access to and full functionality of this system. Prior to obtaining Texas Health Trace, we received our reports from individual hospitals, laboratories, and medical clinics. We also had periodic data that we received from the state electronic surveillance system. Sometimes we call those data dumps. Now, although there's still a few elements that need to be worked out, last week our epidemiology team was able to initiate full access to Texas Health Trace, and we began to identify the COVID cases that were attributed to Fort Bend County that weren't previously reported to or by us. A few of these cases date back to March and April. Some of these cases occurred in May, but the majority of these cases occurred in June and July when the spikes were occurring throughout our region. As a result, over the next several days, we will be reporting large numbers of cases. Each case we report will represent a PCR positive case that was reported to the Texas Health Trace database, but not directly to our health department. This means that although you will see large amounts of additional cases, only a portion of these will be newly confirmed cases. To assist the public in understanding the data that's put on the hub, we will provide identification of which cases were in the database before and which cases are currently new cases. And that will give you a clearer representation of the current disease in our county. Going forward, You're likely going to see additional changes as health departments and hospitals and other reporting agencies have to deal with this ever-changing landscape we call COVID-19. We sincerely appreciate your patience as we are in the process of updating our records with these Texas Health Trace reports. Please know that we are committed to providing accurate data to assist our community in making decisions regarding response to COVID-19. As we are discussing our data, let's remember that each of these numbers represent our family, our friends, and our neighbors in our community. And some of these people may be very vulnerable. So we want to continue doing those things to protect each other, like wearing our masks, like social distancing, physical distancing, and washing our hands. I know we're getting tired of hearing those messages, but we do know that these things work. We proved that they worked back in April, and they will work again. Thank you.
I just wanted to simply repeat what Dr. Minter just said. There is no magic about dealing with COVID. There is no vaccine out there. The only tools we have is just Dr. Minter just mentioned. Safe distance, social distancing, washing your hands, wearing a mask. And if you don't need to go out, don't go out. And if you do go out, think about it. And do you have somebody at home who got a compromised immune system, or your grandparents, or your parents, or your children with asthma? Be careful. I mean, you can bring this home. Maybe you don't have any problem, but you could give it to these people, and their life could be in danger. And absolutely, Dr. Minter rightfully mentioned there are hundreds of times you heard this. Nothing magic about it. That these are the only tools we have. Please exercise healthy, sanitary practices, because that's the only way we can combat this enemy, COVID-19. With that, if you have any questions, we will entertain that at this time. Thank you.
How many cases more are we expected to see?
I will invite Dr. Minter, please.
What's the average number of cases, the extra cases that you're putting in?
Sure. Great question. We can process about 500 a day. So it'll be somewhere around 500 extra cases that we'll be able to process and pull out of that system a day over the next probably week and a half.
Yeah, so how are you going to be able to separate from the new cases that are coming into the county? Is there a way to separate that so you can give an accurate count of how?
Sure. That's a great question, because we want to make sure that we're not confusing people and making people think that they're all occurring on the same day. So we will make sure there'll be a disclaimer or an explanation of how many cases occurred from the backlog that we've added to the total number and how many occurred that are new cases.
How are the cases looking, even with these extra cases, how are things looking right now? Is the county seeing a downturn? Is it evening out? How's the county looking with cases at this moment in time while you add these little cases in?
Sure. That's important information. So we are looking at a period of about 14 days. We saw continuing increases for some time, and then we saw our cases start to level out a little bit, but not over enough time to be able to call it a true trend. So we're hoping to see, as we continue to use the practices that we have, we're hoping to see that will continue, that things will start going down. We also are encouraging people to continue to test. If you have symptoms, if you do not have symptoms, if you're around somebody that you think might be COVID positive, or if you have a vulnerable relative, family member, friend, please go get tested. That's the only way we'll know the level of disease in our county.
So just to be clear, there are no changes. You're not asking the schools to shut down early or anything like that. You're just putting out these cases out to talk about that there will be a rise, but these are mostly cases older, months old.
Right. So yes, to clarify, there won't be any policy changes made on the addition of these extra ones that are coming in the next few days. Thank you.
Based on the backlog that you guys
Exactly. Yes.
What are the general numbers you have now? What are the numbers you have as of right now for the cases here?
So for the cases in Fort Bend County, we've posted about 7,800 cases as of today. Okay, and so then we'll see that increase. The increase that we've seen, I think we posted about 500 on Monday. That was due to a backlog from one of the hospitals and one of the labs. That was a new backlog. That was different than this system. So those things will occur often. I think yesterday we had about 160 added.
Any deaths related to that in our area?
So deaths usually lag on cases. We did report another death yesterday, yes. Thank you.
And also one good thing I just wanted to mention, yeah, there is always, we see there is 1/3 of the population is being cleared. I mean, like it's already tested positive and maybe they're hospitalized, but they're out of there. And so that's a good news. And so with that, if you don't have any further question, we will conclude this press conference. And I appreciate you all are being here. And thank you for your continued reporting, because this is important. People need to get this information so that they could behave that safe sanitary practices and take it seriously so that we all could together combat this pandemic, COVID-19. Thank you very much. Thank you. Thank you, sir. Thank you for being here. Thank you.
Good to see you.